Good morning and welcome to Coffee Talk. Today is June 4th, and I'm Kylie Peck, President and CEO of the Greater Watertown North Country Chamber of Commerce. Before we get started this morning, I do want to make a note that since our last Coffee Talk last week, our region has moved into phase 2 of the New York State phased reopening plan. And just this week, we've seen dentistry, low-risk outdoor entertainment, and most recently, outdoor dining become permitted, and guidance for these industries is available online at forward.ny.gov. And with our businesses reopening and our community becoming more comfortable with venturing out into the community, shopping and dining and moving into our new normal, we've invited Samaritan Medical Center to join our Coffee Talk today. Samaritan will offer advice and best practices when it comes to screening employees, encouraging proper face mask use, hand hygiene, and more. With the subject matter experts with us today in employee health, quality, and infection prevention, the team is ready to answer questions you may have about these topics. In addition, they'll provide guidance and clarity about COVID-19 testing for your employees, when to send for testing, and what the employee can expect when the testing is being done. Samaritan is here to help, and we are so fortunate to have them in our community, have them with us this morning on Coffee Talk, and really work with our businesses to get us into this new normal and answer questions on what that might look like. So with us this morning, we have 4 individuals, teammate members from Samaritan Medical Center, which include Michelle Place, registered nurse and manager of employee health and safety, Karen Abear, registered nurse and director of infection prevention, Heather Clement, a registered nurse and patient safety officer and COVID-19 resource line coordinator, and last but not least, Leslie DeStefano, the Director of Communication and Public Relations for Samaritan Medical Center. So ladies, welcome, and I will ask Michelle to start us out.
Hi, I'm Michelle Place, Manager of Employee Health and Safety. I think Karen's going to start our conversation this morning, though, kind of give you a little information about COVID, and then we'll go into the employee information from there and on to testing information.
Good morning. I'm Karen with Samaritan Medical Center and the infection preventionist for the last 7 years here. Well, we wanted to kind of just give a small little reminder of COVID-19. So essentially it is an infectious disease that is obviously from a newly discovered coronavirus and that has spread worldwide. Most people will experience only mild to moderate symptoms, but we know that it is very concerning because there are a potential for people to become very, very ill. The best way to prevent is to stay well informed and to try to stay up with the most current research on the infectious disease. So the virus we know is primarily spread through respiratory droplets or discharges from the nose when an infected person coughs or sneezes. Those respiratory droplets can also enter the environment and stay on surfaces for a period of time. So we do know that there is a potential for people to still pick it up from the environment and self-inoculate into like our eyes, nose, or mouth. So hand hygiene is still very important. And then of course, the disease is not airborne in its natural state. So it's respiratory droplet. So really that's, 6 feet. So anybody coughing and sneezing within 6 feet of you. Standard precautions are what we use in hospitals and healthcare to prevent disease transmission. It is a set of rules. There's about 7 of them. We're going to talk about 3 of the elements. We're going to talk about hand hygiene, cleaning and disinfection of environmental surfaces, and personal protective equipment. We feel that those 3 aspects will be very helpful to the community in prevention of spread of COVID-19 within your facilities. Hand hygiene, hands down, the #1 way to prevent the spread of infections. So you want to make sure that you're allowing for ample opportunities of hand hygiene. People within your buildings need to wash their hands immediately on entry. So providing a hand hygiene station at entry is important. That way they can clean off anything that may have been picked up prior to entry into your facility. This includes your staff members. before and after customer contact for your staff, after using restrooms, after touching frequently touched surfaces, after touching the outside of the mask. Outside of the mask is considered contaminated, so I'm sure everyone's seen people out and about and they're pulling it up, pulling it down, and then touching a whole bunch of stuff. Well, they've just contaminated everything that they've touched. After cleaning, disinfection of surfaces, we should also provide for hand hygiene, and immediately after glove removal. And again, it must be convenient. If we don't locate it where people will use it, and they have to search it out, they may not go and look for that hand hygiene opportunity. Hand hygiene can be performed with either soap and water or with hand sanitizer. So with your soap and water, you want to make sure that they are rinsing their hands, applying a liquid soap, lather and scrubbing for at least 20 seconds, and drying the hands thoroughly. Wet hands pick up more organisms than dry hands will. And then using the paper towel to turn off the tap. I suggest that with your staff members that you do go through hand hygiene education and sign everyone off on their hand hygiene so that you can prove that you did go through this education with them. Soap and water must be used if the hands are visibly soiled, but the rest of the time they can use a sanitizer product. So with sanitizer, you want to make sure that they're applying enough sanitizer to wet all aspects of the hands. And it must be at least 60% alcohol to be effective. I have included a link to the CDC on how to clean hands. And we do have a competency here that we would be able to share with you if anybody was interested. For cleaning and disinfection, we recommend that you have a schedule for cleaning on regular intervals, but also items that are used by more than one person should be cleaned after each use. You must use an EPA registered disinfectant that is proven to kill SARS-CoV-2 virus. There is a list available on the EPA website, and I have included the link for that. You must follow the manufacturer's recommendations for disinfection and allowing for the sufficient contact time so the disinfectant kills what it is designed to kill. Typically, it's somewhere between 1 and 10 minutes, depending on the product. If it's a product that you mix with water, it's usually that higher contact time. So it needs to stay wet for that entire time in order for it to kill the virus. Usually the pre-made wipes, it's 1 to 2 minutes, up to 5 minutes for a wipe. Samaritan has initiated universal masking for all staff, patients, and visitors and contractors that come into the building. Universal use of masks can help control the respiratory droplets and keep others safe. So what we consider the universal mask to do is more of a source control than a protection for the wearer. It's a protection for the others in the environment. So our thought is that it will contain the respiratory droplets that could contain our virus. So masks must be worn at all time while staff are working. We should encourage them not to touch their mask as it is considered contaminated. If they do touch the front of their mask, they should be cleaning their hands directly afterwards. They may remove breaks for breaks when they are at least 6 feet away from one another and away from public areas. So if you have a dedicated break area, that would be best. And then they can have extended wear for masks in this sense. They can wear it for the entire shift, remove and preserve for breaks and meals. And then again, if it is wet, soiled, or otherwise compromised, they should have a replacement mask available to them. And if staff are wearing cloth masks, they need to be cleaned at least daily, but they should have several available to them throughout the course of the day, because if they become wet, they should replace those masks. And I think that is it for me, Michelle.
Hi, so I'm Michelle Fleiss from Employee Health, Manager of Employee Health and Safety. So I was going to start by talking a little bit about employee screening. Employees, when they come into the building, they're asked to sanitize their hands and apply a mask upon entry to the facility. Employees are then screened for signs and symptoms of COVID-19. Employees are also asked about travel outside of the area. So if they have signs and symptoms, they're denied entry to the facility, and they're instructed to call Employee Health Office. We have a dedicated cell phone that we use for our employees, so they can immediately call. Somebody's there 24 hours to answer any questions. So usually myself or another RN is there to evaluate what's going on with them and take information and determine if we need to refer them to the resource line for potential testing. We're also asked for information on travel outside of the normal area. So their normal area would be, where they live and reside, where they do their day-to-day activities. So we're asking them if they have gone outside of that area for any reason, and we're collecting and recording that information. From there, our office reaches out to them to determine what's going on from there, what kind of contact they've had, and if any monitoring is needed. This could be required for up to 14 days at that point. We've also included some symptoms of COVID-19 for you to review so that you have those. These come from the CDC. So initially, symptoms were more of just fever and chills, cough, shortness of breath. As time went on, we started to see more issues with fatigue, muscle aches, headaches, loss of taste or smell. Now we're starting to see some more symptoms, sore throat, nausea, vomiting, and diarrhea. So they've kind of expanded those symptoms. When we're looking at those, we're looking at a combination of symptoms and trying to determine, in a healthcare setting what their risk is. But these are things that we're asking them to report if they are seeing any of those. So staff assessment, what we do is we, staff who have had any of those symptoms are risk assessed by the Employee Health Office and referred to the resource line as needed for potential testing. They're asked to follow up with us after that call. If they meet the criteria for testing, they're removed from the workplace pending results. If the employee does not meet the criteria for testing, they're referred to their provider urgent care if further evaluation or treatment may be required. So we may have somebody that may not really meet the qualifications for testing for COVID, but they may have another issue going on that we feel they shouldn't be here and should probably see their provider. Staff exposures is something that we come up with on a regular basis, just because of so many people out there in the community with potential symptoms and waiting for testing results to come back. So if we do have a staff member that is potentially exposed, we create what we call line lists, and these are just a list of staff that have had potential exposure. We reach out to them and risk assess each one for their exposure, and appropriate recommendations are made based on this. The recommendations that we go by are the ones that come from New York State Department of Health, as far as if we feel they need to mask, monitor, or be removed from work pending any testing. We continue to have open communication with our infection prevention office, Karen, and Jefferson County Public Health Services to ensure any kind of public health safety and assist with any questions that arise from there. So from here, I'm going to let Heather talk about employee testing.
Thank you, Michelle. My name is Heather Clement. I'm the Patient Safety Officer here at Samaritan Medical Center. I've also been coordinating the efforts for the resource line. Many days, if you do have your employees call, they will probably get me on the phone. So just to give you an overview of what their experience would be when they do call, we would ask them their name, their date of birth, their contact number, just in case we get disconnected, and a reason for them to call. And we would then go through our screening process, just like anybody else. We would always ask, where are they currently working? Are they an essential employee? We would document that. And if they have any underlying health conditions or their age, any chronic conditions. And then we would go through the symptoms as Michelle stated. Also, we would ask if they had been in any contact with anybody that's positive for COVID-19 and any of that travel outside the county. That may come up, and you may be able to ask that as you guys are screening also, but we do take into account if they live in a different county and they come for work, that's not necessarily as pertinent as, going to a hotspot or, going for away to a different area. So we would go through the symptoms and then determine if they needed to be tested. I do want you to know that Samaritan is, we are we want to be we want to accommodate our businesses and make sure that we're collaborating with our local businesses and trying to make sure that your employees can go back to work. I understand that you guys have different New York State guidelines that say that, you know, your employees either need to stay home or they need to be tested. So we are more than happy to accommodate that for our local businesses. So the first part of screening determines if they need to be tested. And then the last part, we would never tell employees, I just want you guys to know that we would never tell employees at the resource line that they can't go back to work. We would always tell the employees to contact their employer, tell them that they're being tested, and then your HR departments would determine if they need to come back to work. So that's just communication that I want you guys to have from Samaritan, is that that's not really our call, and we would not give that information to your employees. So if that were to come up. The second part of the screening process is really determining where patients should follow up with, determining on their symptoms. We would determine if they're emergent, then they need to be seen emergently soon, depending on how severe their symptoms were. And then if they weren't as severe, they need to follow up with their primary care provider. And we would always encourage them to reach out to you. So another thing, we do have little cards that, you know, if you would like, we can maybe send to our local businesses for the resource line information on there. And just to let you know, one thing too, we do have the address to the testing site if you would like that. We are having several calls about where it actually is, where it's located. They will need to bring their picture ID with them. They'll put it up to the window. They always stay in their car. They don't get out of the car whenever they come. Yes, so the testing will come back in 2 to 3 days. We will not perform expedited tests. So we don't have enough kits. That's communication that you guys should know, is that we are allowed to perform that here in our lab, but the shipments don't always come as promised. There's a shortage of supplies. We would love to accommodate that, but we do not have the expedited test. So our tests do come back in 2 to 3 days. Jefferson County Public Health is usually the one that they get their results from. Patients or your employees can get on the patient portal through SamaritanHealth.com and get the results immediately to be able to share with you. Otherwise, they could contact Jefferson County Public Health, and we do have that number too if they were to call with that. So just for that, for results purposes, would be through Jefferson County Public Health. And that's really all I have. Do you guys have any questions for us?
Hi, this is John Elmer. I work with Brookfield Renewable Power. I'm director over here. We seem to, and we are an essential business, we've seemed to struggle with this testing issue quite a bit. So with regard to, I just want to be clear, we can't really send somebody, you know, to a testing center and just be tested, regardless whether they're asymptomatic or if they're asymptomatic. Am I understanding that correctly?
So it depends on what your guideline is. So if your New York State guideline says that they're asymptomatic and they can't come to work, we can try to work with that, but we are testing those that do have symptoms. These would be employees that you deemed would need to be tested prior to coming to work.
All right. If there are any questions, I ask that you submit those into the chat feature. I have a question, and this is really more specific to a specific industry and not necessarily employee testing. But in the food service industry, if someone preparing food is not wearing a mask, does that risk the spread of infection?
From my perspective, yes, that does. If they were an asymptomatic shedder or someone that was ill and still contagious, there is the potential that they could shed virus onto food that they prepared, and then that food would then be consumed, and by the consumption through the mouth could enter the mucous membranes of the nose and throat. So absolutely, food preparers at this point. I mean, I think we're in a position where universal masking is essential to all of our work.
We can give you that number too if you guys want to take down the number. I have it. If you want to take down the number, it's 1-888-364-3065. And to answer John Elmer's question from earlier, there are hairstylists that are calling that they're part of those essential workers, and we are accommodating that for them. Those would be asymptomatic workers that need to get back to work, and we do have an order process for them and are accommodating that. So if there are any workers like that and you have a New York State guideline that says that your employees need to be tested prior to going back to work, you can call the resource line and we can work with you on that.
But we do have some questions coming in from those included on the meeting. What are your thoughts on taking employee temperatures and keeping records?
So at this point, we are taking temperatures. We're not recording them when they come in. We're just looking to see if they're running a fever or not. What we're looking for is anything over 100. If they're 100 or over, then they're asked to call the employee cell phone, and then one of the RNs there will evaluate the situation and what's going on. We're not recording them. They're just coming through. We do record temperatures if we have somebody who has been potentially exposed, and we're monitoring them for a period of time. We do record them in that situation.
Okay, great. And this may be a silly question that I have following that. Is there a certain type of thermometer that is required to do this testing? I know you don't want to be in close proximity, but maybe people don't have access to the thermometers that, allow for 6 feet distance.
We use temporal thermometers. So it's kind of a scan across the forehead and just behind the ear. So we're also not maintaining 6 feet during our temperature taking, but do have our employees clean their hands, put their mask on prior to getting their temperature taken. So there is a double mask. And that seems to be protecting everyone from having any kind of exposure there. But we do use the temporal, and that is a fairly accurate thermometer, and doesn't really cause contamination or cross-contamination from person to person. We do clean in between, but an oral thermometer, I would think at this point would be an inappropriate choice. So anything that you can keep away from the nose or mouth would be preferential.
Okay, thank you. With the recent protests, we can see over the television that social distancing is not happening in mass groups. Are there any indications that we may see an uptick?
So there's always that potential that could happen. Usually somebody can be asymptomatic for 2 days prior to and spread the disease before they can actually develop symptoms. So knowing that the window is anywhere from 2 days before symptoms start to 14 days. So there is that potential period that could happen, and we just have to wait that period out just to see what happens during that time.
So the symptoms can show up anywhere from 2 days after exposure to 14 days after exposure, but we're seeing an average between 5 and 6 days. So I think anytime now we should be starting to see what could happen from that, and I would anticipate that we'll see at least a little bump up in our exposures due to that. I think we'll also probably we're still in that window where we'll see some stuff for Memorial Day as well, because I know that we did see an increase in gatherings from the holiday as well. So I think that we will see an increase. What that looks like, I don't know, but I'm certain that we'll see some uptick.
In addition to that, too, we've also noticed, with the weather and the holidays, there's a lot of people that are doing more traveling than were before, especially with things starting to open up. So that also happened around Memorial Day weekend as well.
Okay. Do employers need to take temperatures of employees or customers or both? Or does it depend on which industry you're included in?
I would say it would depend on your industry and what those guidelines say.
Thank you. As a non-healthcare provider, do employers need to monitor employee temperatures and symptoms, or can we just wait for public health to give them the release to get back into the community?
So this is post-exposure or after disease that we're asking. So public health will drive that when they can return to work. As far as initially, I would say it would be important as we're opening up these businesses to be screening our staff daily for symptoms and for temperature. I would recommend that. I think that that's helped us a lot. We started doing that far before New York State Department of Health required it. And I do feel that that did help us keep our staff and our patients safer. So given that we have a lot of things happening all at once, that the potential for exposures to others, it's there. And I think that the best way to stop that from happening is to monitor for symptoms and for temperature. Now that's not going to get everybody because there are people that are asymptomatic, but that's what our masks are for. So I think that we do have that potential there to help kind of squash this bug, if you will.
So public health will also release them once their symptoms are improving. So they may not release them saying that they're fully recovered as far as no symptoms. So from there, we go by what our hospital policies say. So I would say that you would want to look at your policies as well and determine if you have any policies regarding sick workers coming to work.
Okay, great. I've seen some individuals wearing gloves out and about while they're shopping. Can you talk a little bit about that? Because I have seen that there's some mixed information out there on whether you should glove or not glove, if it's helpful or not. Can you talk a little bit about that?
I will. This is Karen, just a pet peeve of mine. I think that there's a significant misunderstanding of how the gloves work. Obviously, the gloves can protect the wearer's hands, but if we're still touching things and then touching our personal belongings and touching our face or touching our mask with those same gloves that we just touched a whole bunch of other stuff with, it's not helping us at all. I think that gloves do have their purpose, but I think in this sense, if we just wash our hands a little bit more, that's going to be more beneficial to us than having gloves on. So the gloves really will only protect our hands. And then, if we take them off and don't clean our hands directly afterwards, that's not going to help us either because we can contaminate our hands with the removal of the gloves. So I think if I had a choice, if I could take them away from everybody right now, I probably would. But the gloves are less essential than the hand hygiene, and the hand hygiene really needs to be promoted and required in our public spaces.
All right. Well, it looks like our questions are slowing down. I guess I'll ask for final thoughts before we close off our coffee talk for the day. Do you have any final thoughts you'd like to share with our group this morning?
I think from my perspective, I think that the North Country is doing a great job, and I'm really proud of all the work that everyone has done thus far. And I think with us slowly opening up, and if everyone just would take the time to ensure that our staff is appropriately educated on what they can do to mitigate their risks, I think that we will all come out on top of this and keep our community safe.
And Kylie, I just have a few logistical standpoints because the hospital is a little bit different the way people enter your facilities, but just think about your entry points where you're going to have screening. If you're like us and you have 50 entry points, we're now down to just three entry points so that we can really monitor our employees coming and going, any visitors that are even allowed in this facility or patients. So think about that just from a logistical standpoint. We also have tools available. So when we talk about temperature screening our employees, we actually have a sheet and it says if you're too low, then we rescan you. If you're within this range, we rescan you. If you're higher than this, you will need to call employee health and you will need to leave the facility. So we have some tools like this because we've been doing it a long time, and we'd be happy to share. We have a vendor log. We have an employee travel log. We have places where our employees, when they leave the facility, they don and doff, so put on and take off their mask appropriately by putting it on a paper towel with their name on it. There's a lot of little things that we're doing that you might not be thinking of, but it is part of proper screening, proper visitor management, and really how to take your mask on and off appropriately.
That's great. Thank you. I can get some of those resources from you, and when I send out the information, you know, in the recording of this session, we could send those resources out as well for some businesses who may not know where to begin or what the appropriate tracking methods might be. So I think that would be really great. So if there's no other questions and all final thoughts have been shared, I'd like to thank Michelle, Karen, Heather, and Leslie for joining us this morning from Samaritan Medical Center for our coffee talk. As we continue to open up our economy and we're getting more comfortable moving around the county and beyond, we need to make sure we're continuing to be responsible, you know, use our face masks and proper hand washing techniques to make sure we're keeping ourselves and our families safe, and of course keeping our community safe as well, so we can continue to open up and move forward into the new normal or the next normal that some people are referencing. So thank you so much to the Samaritan team for joining us this morning. It was fantastic to have you. So thanks so much and enjoy the rest of your day.
Thank you.
Thank you.